For those of you that may not know, in December of 2014, Mike O'Keefe informed me of his decision to retire as CEO of Evangelical Community Hospital, an institution that Mike has served for more than 25 years, the last 10 years as our CEO. Mike has simply decided, for personal reasons rooted in family and what he feels is best for the institution, to retire as our CEO. And I'm sure he would prefer that this morning we talk more about the future of the hospital, so that's what we're going to do. In its 89-year history, this isn't something that Evangelical Community Hospital does very often. To date, we've had 4 chief executives, and I'm here today to introduce our 5th. It's Kendra A. Aucker. Kendra Aucker has served Evangelical for nearly the same time frame as Mike O'Keefe. She came to us in 1990 and has been with the institution most of the last 25 years, serving our last 5 years as COO. This isn't a process or a hire that we take lightly here at Evangelical. Back in December, we began a process of due diligence and process, but we knew that we had an exceptional leader within our midst. We engaged the services of Whitkeefer Consulting from Boston. They visited with the campus, met with a number of employees, doctors, nurses, community members, patients, and stakeholders, and they helped us construct a profile for what we looked for in our next CEO. We were looking for someone that was adept at building relationships, alliances, and partnerships with other regional healthcare providers, someone that could strengthen community outreach and advocacy, develop short and long-term operational and financial goals, and perhaps most importantly, we were looking for a leader to reaffirm to internal and external stakeholders the value of being an independent community hospital. Our advisors from Whitkeefer got to know Kendra throughout the process and enthusiastically concurred with the board of directors that she would be an outstanding choice for our well-being of our hospital, its partners, and its employees. So it's with great honor and pleasure for me to formally introduce to you the next CEO of Evangelical Community Hospital, Kendra A. Aucker.
Thank you. I'm honored to be a part of Evangelical's long legacy of caring for this community. These are changing and challenging times in the world of healthcare. Increased government regulation and decreased reimbursements are forcing fundamental shifts in our industry. However, I know if we continue to seek out new efficiencies, explore new collaborations, and carve out strategic growth in ways that will meet tomorrow's healthcare needs, we can and we will continue to deliver and meet our mission, which is to provide high-quality, affordable care in the most compassionate way possible. I'm energized by the opportunities that are before us. I look forward to further engaging our physicians, leaders, employees, and the community to seize on these opportunities and position Evangelical Community Hospital to continue to meet the health and wellness needs of those it serves. Well, I've been somewhat focused in an operational role, and there are certainly contingencies of individuals that I would like to have more in-depth conversations with. I'm very excited about getting out into the community, about getting in front of other healthcare institutions and discussing strategic collaborations, ways in which we can work together. Evangelical is extremely blessed to have strong financial and clinical platforms in which to execute through this challenging time. And so I'm anxious to just begin the conversations and work with a really good team of people that exists here to figure out our next steps so that we can continue to stay strong for our community. There's a lot of conversation in healthcare when you're a community hospital about independence, and I think independence can no longer mean being isolated. And so we have many strategic partners. We work very closely in positive ways with Geisinger, with the Susquehanna Health System, with Hershey Medical Center. And I think those partnerships make us strong in that they allow the strengths of those institutions to be available to our patients, and it makes it easier to receive high quality health care. We live in an incredible region for good health care. You know, I think that a measure of success of Evangelical, you know, is the people. It is the kind of institution we have here. You know, I think our culture is patient-centered, and that makes us successful. There's a great deal of conversation in healthcare about the patient experience, and I think that's what we've done very well over the years. We are caring, we are compassionate, but we also have advanced programs here. And I think one of the most recent things we've done is open our own Heart and Vascular Institute. In July sometime, we will open the doors on a new center. We now have our own interventional cardiologist. We have employed 2 other cardiologists. We have a vascular surgeon. You know, we do things at times that are not necessarily common for a community hospital. And we do those because we have the support of the community and they want to stay here, and we do it well. And so I think it's a combination of both. I mean, we have an incredible medical staff here, and a lot of community hospitals are struggling to recruit. We recruit a lot of physicians, and you don't have physicians, you don't have a hospital. So we have excellent clinical staff, and we provide, I think, high quality, you know, compassionate care, and that's the future of the institution, I believe.